Larry, and I have a special guest in the house, in the studio, in the house with me today, in the person of Mrs. ADERONKE IBITOye, Director, Business Development and Client Relation, Odchc, that's Ondo State Contributory Health Commission. Thanks for joining us once again.
Thank you, Mrs. Molilari. Thanks for having me. Thank you so very much.
It's nice to have you. Today we're talking about pensioners. And who are these pensioners and how do they come into the system?
Okay. Pensioners, like we know that they are retired civil servants. They are retired from one ministry, department, agency, so to say, within the state, civil service. And these are the people that draws their monthly pension from the government, pause also. Okay. So just like the civil servant scheme that we have, and for also political office holders, which we could name Orange Health Insurance Scheme for the civil servants and political office holders. So this one we are talking about for pensioners is also to ensure that we bring them under the safety net of health insurance. So you can see that we are collaborating with different ministries, departments and agencies to say that how can we bring people into the safety net, so also for our pensioners too. So we have been moving around the 18 LGAs to ensure that due to the verification exercise they are doing for the pensioners in the state, we now leverage this to say, okay, how can we collaborate with them? So our officers have been moving around the 18 LGAs to ensure that we do sensitization and also medical outreaches for them so that we can know their state of health. You can see that the government is doing a lot to provide financial support for all residents of the state.
That's very nice. So with what you said, I mean, sensitization is currently going on.
Exactly.
Okay.
Yes, it's currently going on.
How can they get access to this service? I think you didn't really touch more on that. How can they have access to this service?
Yes, it's just straightforward. The access to care is just for them to participate in the scheme. And this has been the message that we have been disseminating over the few weeks that we've started the sensitization, to say that come on board, participate in this scheme, and it's just for them to pick an accredited, facility of their choice. We do not pick facilities for them. So that is why you see that for the government is doing a lot to ensure that they have enough healthcare centers, both primary and secondary and even tertiary centers that can actually provide the requisite services that all the teeming residents of Ondo State will need. So for pensioners, it's just for them to give us their nod to say that they are participating as a whole. For example, in the few months ago, we were able to bring the retired head of service and also permanent secretaries that got retired, on board, because we have, two caveats of pensioners in the state. Yes. So for them, they've, joined the Orange Health Insurance Scheme. And since April 1st, they've been able to access care across their chosen facilities. So you can see that also the government is ensuring, for example, about a few weeks ago, His Excellency Governor Lucky Orimisun gave the marching order and approval that all primary health centers in Ondo State be revamped. So out of the ones we have, at least 102 has been picked so that they can revamp these facilities. In case some of our enrollees pick all these facilities, they'll be able to access adequate services from these facilities. Okay.
Yes. With what you just said, I can tell that there is so much benefit for the pensioners. Would you like to tell us what are those benefits? Because for those caliber of people to have even registered, that means there is the benefit is mouth-watering, if I must say. So what are those benefits that they enjoy?
They enjoy. The Orange Health Insurance Scheme for civil servants and political office holders started in 2022. Okay. That is, and also the access to care started in that same year. after the flag off. And you will see that it is that same benefits embedded in that scheme that is also embedded in this one that we are telling our pensioners to, you know, participate in.
Yes.
So ranging from services like outpatient services, inpatient services, admissions, for a lot of surgeries are covered under the scheme, diagnostic investigations like CT scan, MRI, and minor investigations that they might want to do in the hospitals, checking of their blood pressure, and also checking of, you know, blood sugar level, you know, a lot of things, you and creatinine. I don't want to bore us with medical terms.
Yes.
Yes. So we have a lot of things that are embedded, and also referrals are there, like physiotherapy and the likes. We have for ear, nose, and throat. We have for ophthalmology care. You can see it's, you know, a very big, services that is embedded in this scheme, ranging from different things I've mentioned, dental care. So name it. Majority of these services, yes, that is embedded in the, the scheme. You will see that these are the major things that majority of these pensioners will even need, so that we can, you know, prolong their life expectancy. Because you agree with me that a nation, or let me say a state now, let's come to the level of state, a state that is not looking at how to prolong the life expectancy of its residents is not doing anything. So in these regards, you can see that the Ondo State government, under the leadership of our maybe Governor Lucky Orimisoayedatiwa, is ensuring that they don't want to relent in any of their hours to say, bring everybody on board under this safety net to prevent people from financial hardship, so that we can be prevented from, you know, catastrophic spending and the likes. So the health insurance is for all residents. So we are just taking it one step at a time. So at this time that we see that, okay, the pensioners are having, you know, activities across the 18 LGAs. Currently, we have pensioners in Akure South. The venue is NUT House now, and our officers are there doing sensitization.
Oh, that's nice.
And also other local governments. In our local government yesterday, they were there for sensitization and also for medical outreach. And, you know, these are the things that can help them to actually know the services and benefits embedded in this scheme, and also to be able to know their state of health. So you can see that the government is ensuring that even the vulnerables and also the people that are able to pay for their health insurance are also brought on board. So it's just for them to, you know, give their nod to say that, oh, they are ready to participate in the scheme, just like the ones they are doing for the civil servants and the political office holders. So they draw this premium from their monthly pension, just like the way they draw.
I was going to ask that, because now we are dealing with pensioners, and I was going to ask, how is this revenue going to be extracted? And, you know, also we are also, if you check the categories of these pensioners, most of them are aged and elderly. So how convenient is it going to be for them? So it's still being sourced. We're still talking about the finance. How is this money going to be extracted, and how convenient are you making it for them, considering that they are aged and elderly? And so, you know, we know that they need this this money to take care of themselves. Yes. So how convenient are you? Is there any like special treatment? Yes, considering the category of people we are dealing with.
Yes, thank you, Mrs. Molilari. The major thing is, I want you to know that this category of people, like you said, they are elderly. Yes. Majority of the, chronic medical conditions, they affect this group of people, true. Ranging from hypertension, diabetes mellitus, rheumatoid arthritis, and so on and so forth. Yes. So you will see that they really need these services. Majority of them, if you look at the amount they spend monthly for their healthcare needs, it is not comparable to the premium we are even, telling them to drop, so that they can be using this to take care of themselves. I will be receiving a lot of nod from these members of pensioners to say that they are ready to participate. In most of the LGAs we visited, majority of them were asking us for the forms right away that they want to register, because they know the amount of money they spend monthly on drugs, on investigations to take care of themselves. So they now see it as just a token to be dropped, and they will be able to access, care for a very long time. So you will now agree with me that this will prolong their life expectancy, and also they will be relaxed that there's no need of, spending, anyhow for maybe drugs.
A bit secured.
You understand? They are insured.
Yes.
So it's just the normal concept of insurance to say that you are rest assured that even if you fall ill, you are not going to spend out of pocket.
Yes.
So the major information has been that participate in this scheme so that you can, be rest assured that you are under the safety net of, this health insurance. So it is a major goal of the SDG 3.8 to achieve universal health coverage. So you will see that if we are looking at the monies, that is a premium that they will be dropping at the end of the month, or let me say as a yearly plan, that you now be thinking maybe because of this money they will not be able to participate.
Yes.
We will not look at the benefit. We will not be, what I'm trying to say is that if you are looking at that money, you might not really put your mind in the benefits that are embedded in the scheme. So looking at the benefits that we have in the scheme, we have states that are doing a lot regarding that, aside this one that we are having, in stock for the pensioners. But you will see that majority of them are not enjoying what they promised them that they will enjoy. But for us in the states, under the leadership of our amiable governor, we are doing what is best. The global best, practices is what we are, using in Ondo State. So to say that very few percentage of their monthly pension will be dropped.
Okay.
Unlike even the ones that the civil servant and the political office holders are dropping.
Yes.
So it is a reduced percentage, and for Orange Health Insurance Scheme, for the civil servants and political office holders, it is a progressive contribution. So that is what we also be for this group of pensioners.
Okay.
It is just for us to encourage ourselves that we put money in a pool, then from this pool we pull out funds to take care of the teaming enrollees that are under the scheme.
Okay, so and how has the turnout be so far? How has it been, the turn up?
Yes,
how has it been?
I said earlier that even majority of them
requesting
for forms right away. They wanted to get enrolled into the scheme. So currently we have close to 100 of the pensioners that we have on board.
Nice
but
amount.
We are hoping that before the end of this second quarter, the NUP on those states will be able to give their nod to say that they will participate in the scheme, in full, because these ones I'm talking about is the first leg of the retired head of service and permanent secretaries in the states.
Oh, okay.
Yes.
So we can see that the turn-up is actually, it's really great.
Exactly, because you even see that majority of them that fall under that caveat are not even more than that number that I just said.
Yes.
So that's just the number of the retired head of service we have in the states and also permanent secretaries. That's why we are having that number. So by the time the NUP, the other NUP group joins the scheme, you will now see that they have about 50,000 data, according to the database that we were given, they have about 50,000 membership base. So you now see that if they join the scheme, they join together, we'll be able to pull funds easily to take care of anyone that falls ill amongst them. So to the tune of even sending majority of our enrollees to places like Abuad, Afe Babalola University in Ado-Ekiti.
Okay.
Yes, for things we don't have, which the government is working assiduously to ensure that we have very soon, like CT scan and MRI. very soon we'll be having it in our state. But we do send our enrollees there right away now.
Okay, with what you just said, so that means Oranghis is not just for the state alone, in the sense that you can also be referred, you are covered if you are going to, if you are, let's say if you are a member, if you are enrolled with Oranghis,
yes.
so can you also be referred outside the state? I thought it was just maybe within the state, or there are cases that you have to do that.
Yes, the Orange Health Insurance Scheme, like I said earlier, you know, is for civil servants, political office holders, and all residents of the state, like pensioners and every other people that belongs to the state. So they get registered in Ondo State.
Okay.
Yes. So for our offices, liaison offices in Lagos, in Abuja, they are part of the scheme.
Okay.
So we do give them facilities in their environment. In Abuja now, they have facility where our enrollees are using for workers that are in Abuja liaison office, and also for workers that are in Lagos liaison office. So there are accredited centers of Lagos State Health Insurance Management Agency that we have, you know, worked with to say that let's use this facility also for our own enrollees.
Okay, so
because they've been accredited in those states.
Okay.
So for some of the enrollees that are not in these places I've mentioned that do need some interventions.
Yes.
There are times because we believe that there's no one that can have everything all. So we are trying to work with the Dawn Commission to talk about social, you know, Southwest integration.
Okay.
To say that how can we bring other states on board to help us to be able to provide care for some of our enrollees that majority of times maybe they travel out from Ondo States, out of station, and they fall ill. We don't expect that they bring them back to Ondo State. They can always use facilities that are accredited there. But in that instance, we need to be notified at the level of Ondo State Contributory Health Commission. And when they notify the client services units and the case management units, it's just for us to speak with such, you know, facility, and the care will be. In fact, majority of these facilities we are talking about, we have been having a lot of conversations with them. And some of them we've even signed contracts to say that please do provide services for our enrollees when the need arises. So like UCH, Obafemi Awolowo University Teaching Hospitals Complex, and some of those hospitals in the Southwest. So we've been having a lot of conversations with them, and we've been sending some of our enrollees there to access care. Yes.
I think that's something that we probably have not really spoken about. So that means even if I'm enrolled or registered in Ondo State and I need a medical attention in, let's say, Ekiti or Lagos State that we do not have in Ondo State, so that means I can also access facilities that have been registered with Oranghis over there, irrespective that I was not enrolled in that state.
Yes, it's only that the services must be part of the you know, services that we have said we can provide for this kind of enrollee that needs such at that time. That I mean that is embedded within our benefits package. You know, there are covered services.
There are covered services, yes.
Even some of them that do need intervention that are not even within the covered services. It's just for us to get approval, and majority of them that we have done that for, I cannot even mention. Majority of them do come to our office secretariat to say thank you to the commission, that they never even imagined that
how
they could
far you
access
would go for them.
those care. So you will see that those approvals were not under the you know, the ambit of the commission's management. Even we do get this approval through the office of the Special Advisor on Health, Professor Simidele Odimayo, to the you know, governor. And when they give us the approval from the office of Mr. Governor, it's just for us to, you know, swing into action. Then we do the needful. So we've done a lot, and that is why for us we've covered about 120 enrollees under the Orange Health Insurance Scheme. So that is why we are creating awareness to bring people, you know, the artisans, the yalojas, traders, road transport workers, that let's come together, various associations. Last week we just concluded on the dissemination of our informal sector strategy document, so that we can, you know, hone a policy document as to how to drive enrollment under the informal sector scheme. So you can see that we are doing so many activities pari passu to ensure that we bring the residents of Ondo State, be it Yoruba, Hausa, Igbo, in as much you live, work and play in Ondo State.
Okay. Remember you mentioned that Oranghis, aside the person who enrolled directly, it also affects the spouse and I think 2 or 4 of the children.
Yes, that's the one designed for the civil servants and political office holders.
So my question is this: what if that the dependent of the person who registered also needs medical attention in another state? Is the person also entitled to it?
Yes, there are some services that are majorly for the principal contributor, which is expressly stated. In fact, they were also stated expressly in the benefits package. So it is expressly stated that, okay, for this one, it is only for principal contribution. So there are exclusions, but it's just for few of our services.
Okay.
But majority of those services, if they need them, just like you have asked, it's just for us to provide it for them, just like the way the principal contributor is also enjoying his or her own. So for the ones designed for the formal sector, is also the type of plan, which is the family plan. So for the informal sector, we also have individual plan and also the family plan.
Okay.
So the individual plan sells for 18,000 for ages below 60, and also for ages above 60 sells for 36,000. Family plan sells for a discounted price of 90,000. Because if you multiply 18,000 by 6, it should be 108. But it is at a discounted price of 90,000.
Okay. I think you should also mention our office address for those who are interested and would like to participate or enroll with the corporation.
Yeah, thank you very much. Our office is beneath the Ministry of Health, the ground floor, and the name of the office is Ondo State Contributory Health Commission. So when they come to us from between the hours of 8 to 5 p.m., they will definitely meet us there. Yes.
Thank you very much. We
you
learn every day. I hope next time you would also be with us on this program.
Thank you very much for having me.
Yes. Thank you all for joining. I hope you've learned a lot. And just like she said, health is a very important aspect of the human life, and of course, make good use of this opportunity. Make good use of this opportunity. Try and enroll if you fall into any of the category, either the formal or the informal sector. Please do try and enroll. Do you have agents that can help facilitate these enrollments?
Yes, we have agents across the 18 LGAs in all of our accredited facilities that are desk officers on the scheme that can also help us in driving the enrollment process. And we also have our third-party administrators across the 3 senatorial districts of the state. We have the Live What, we have the IHMS, and also the United Healthcare HMO. Yes.
All right. I can see how convenient Oranghis is making it for residents of Ondo State. So of course, like we said, health is wealth. Pay attention to your health, and with Oranghis, your health insurance scheme, of course, your health is being prioritized. So yes, we've come to the end of today's edition.